Cleft palate and cleft lip. Cleft lip and cleft palate are malformations of the face that may occur individually or together. Cleft palate occurs alone in approximately 1 in 2500 live birth and occurs most often in females. These abnormalities appear to run in families, therefore, it to be influenced by heredity. But non-genetic factors may also be involved. And other abnormalities such as chromosomal anomalies, intellectual and hearing impairments are common along with cleft palate. As in the picture, the cleft palate is a fissure may involve only in the soft palate or it may extend to the hard palate or the nose. The cleft is in the midline of the soft palate and on one or both sides of the hard palate. It is usually longitudinal. The cleft forms a passage between nasopharynx and the nose. This passage may cause difficulty in feeding and is a factor of susceptibility to infection. The infant is unable to suck well, and even if sucking is attempted, part of feeding or part of feeding items or milk that may be expelled through the nose. That is the main clinical feature that will be exhibited by the infant. The difficulty in feeding, and also there is high chance of infection. In this picture, you can see cleft lip. Cleft lip is due to incomplete fusion of the central processes with one or both of the external processes, from which the area around the upper jaw, lip and nose is formed. The fissure may be unilateral or bilateral. So the cleft lip is due to incomplete fusion, that mainly in the fetal development stage the incomplete fusion occurs. So that make a problem in upper jaw, lip and nose. It may be unilateral or bilateral. We can see that. So the types of cleft lip include the unilateral, that is below the center of one of the nostrils. So you can see in this picture, unilateral incomplete is the one type, that is below the center of one of the nostrils there will be unilateral cleft lip, and that is incomplete, only one side. It is not extend to the nose, it is only one portion of the lip, so that is unilateral incomplete. Another one is unilateral complete. So here that will be extend to the nose. Unilateral complete, the cleft lip that extends to the one side of the nostrils. Next one, bilateral complete. So bilateral complete means here both the nostrils will be involved. So beneath the nostrils will be involved. The bilateral complete is more complicated. The complete cleft usually involves the alveolar process to some degree and the alanacea is displaced toward the side. The floor of the nares and the gum in which the upper teeth are set may be deformed. With severe malformation, the child or infant not able to create vacuum inside the mouth. That's why the child is not able to suck. So that is the main problem in complete bilateral cleft lip. So due to these abnormalities, there will be deformity in the gum also. So that's why the child is not able to produce a vacuum in the mouth. That's why the child is not able to suck. So that's why when the child having cleft lip along with cleft palate, firstly we are preparing the cleft lip first, then only we will clear the or we will manage the cleft palate. Now we can see what is the pathophysiology of cleft lip and cleft palate. So I already explained that when there is diffusion or when there is a failure in the fusion occurs, the cleft lip and cleft palate occurs. So embryonic development in the lower lip and nose fuses with five major facial nominances. Here, lip development that occurs in third and seventh week. Palate development occurs fifth and 12th week. So, failure of fusion of the maxillary and premaxillary process fusion that leads to complete or partial or non-union may affect the palatal bone, upper lip along with the maxilla or premaxilla and tissue of soft palate and uvula. So that leads to cleft lip and cleft palate. So as we said in pathophysiology, the lip development that occurs in the third and seventh week, palate development in fifth and 12th week. So here there will be fusion, a failure in the fusion between maxillary and premaxillary process that leads to the complete or partial non-union of palatal bone, upper lip or maxilla or premaxilla or the soft palate or the uvula. So that leads to the cleft lip or cleft palate. The signs and symptoms of cleft lip and cleft palate, usually there will be infection. Infection, it may be ear infection or it may be aspiration related problems like a pneumonia may be occur or other infections may occur. Then feeding related problems, there may be swallowing problems, there will be sucking problems. So the feeding is very difficult task in cleft lip and cleft palate. Then next one, speech and sound problems. So the difficulty in producing accurate sound or clarity in speech will be delayed in case of cleft lip and cleft palate. Then hypernasality or the nasal air emissions also will be present. Then choking, coughing, especially in feeding there will be coughing and choking. Then there will be difficulty in breathing also will be present. So these all are the signs and symptoms that can be seen in cleft lip and cleft palate. Regarding the diagnostic evaluation, prenatally we can maternal ultrasonography we can do. Then after birth, usually the visual examination of the mouth that can be confirm the diagnosis. Okay, when we are open the mouth, we can see the fissure in especially in case of cleft palate and cleft lip open. We can visualize the lip. So there will be failure in fusion that easily we can visualize. Then physical examination of mouth also a diagnostic measure to diagnose the condition or confirm the condition. So usually the visual examination, that is the better method to confirm the disease. The main management of cleft lip and cleft palate is the surgery. So for cleft palate, we are doing palatoplasty. Palatoplasty that requires general anesthesia and intubation. A mouth gag is used throughout the operation in order to permit access to the palate without obstructing the airway. The lips may therefore become dry and cracked if a soothing or antibiotic ointment is not applied. So that we have to consider because there is chance for cracking of the lips or the tongue. So that have to be prevented. And after the palatoplasty, we have to make sure the NG tube feeding. Otherwise, there may be chance for the infection. So that's why the NG tube feeding is good for the child. Then bleeding also should be controlled, and atelectasis, pneumonia, preventive measures have to be done. Then antibiotics have to be continue. Then restraints have to be used because there will be irritations due to suture lines. So the child may introduce their finger in the mouth, so that have to be prevented. So that's why we have to use the what to say, restraints have to be used. For cleft lip, we are doing the cheloplasty. So cheloplasty is a good and cosmetic surgery for cleft lip, and here Z-shaped suture lines we are using. So these techniques minimize notching of the lip because of the retraction of scar tissue. Immediately after the surgery, the incision should be secured. Otherwise, attention in the suture lines that may cause scar abnormalities. Then the procedures that induce tension in the suture line have to be avoided, especially the facial movement, then crying, then the lip closure. All those things have to be avoided. So what we have to done is we have to provide some slight dose of anesthesia. Sorry, sedation to the child. Okay, so that is the management we are doing for the cleft lip and cleft palate. And usually, cleft lip surgery will be done first, then the cleft palate surgery. The time duration for cleft palate is 6 months to 5 years. And the cleft lip surgery can be done immediately after birth. So these are all regarding the cleft lip and cleft palate. I hope you understood. Thank you.